Namaskar. Today we'll study tetracycline antibiotics. So they have a tetracyclic nucleus because of which they are called tetracycline antibiotics, and some of the examples of tetracycline antibiotics are tetracycline, oxytetracycline, 7-chlorotetracycline, rolitetracycline, doxycycline, minocycline, sancycline, methacycline, demiclocycline, limecycline, clomocycline. So these are some of the examples of tetracycline antibiotics. And if you see the mechanism of action of tetracycline antibiotics, they inhibit protein synthesis in bacteria. So in bacteria, the ribosome complex is the 70S ribosome complex, which consists of the 30S subunit and the 50S subunit. As we know, you can refer to our class on protein synthesis, where this 30S subunit is the subunit to which messenger RNA binds, and 50S subunit to the 50S subunit transfer RNA binds. So messenger RNA has the genetic code required for the protein to be synthesized, and as you know, the protein consists of amino acids, and the transfer RNA provides the amino acids by recognizing the genetic code or codon in the messenger RNA through its anticodon in the tRNA. So first messenger RNA binds to the 30 subunit, then it forms a complex to this the 50 subunit, and the transfer RNA complex binds, and the anticodon of transfer RNA recognizes the specific codon in the messenger RNA, and accordingly the codon specific amino acid is supplied, and one after another the amino acids are supplied, and they join together to form the polypeptide or protein. So tetracycline antibiotics, by inhibiting the 30S subunit of ribosome, it inhibits the protein synthesis. And tetracycline antibiotics also has another mechanism of action. They bind to this transfer RNA that initiates this translation process. So tetracycline, the major mechanism of action is it inhibits the 30S subunit of ribosome. In addition, it can also inhibit the transfer RNA binding to the 50S subunit, so that there will be inhibition of translation process. So overall, we can say tetracycline inhibit protein synthesis by inhibiting 30S subunit of ribosome. Then tetracycline can be used in many diseases, in many bacterial infections. So the tetracyclines are called broad spectrum antibiotics, but they are bacteriostatic. They inhibit the growth. They are bacteriostatic tetracyclines, and they are the drug of choice in plague, cholera, rickettsia, chlamydia, mycoplasma, brucellosis, Lyme disease. They are the drug of second choice in respiratory tract infections, acne, acute bacillary dysentery, amoebic dysentery, and they have many side effects. So why there are side effects? Let us first discuss the pharmacokinetics. Tetracycline forms a complex with metallic ions like calcium, magnesium, iron, aluminum, and this forms a non-absorbable complex. So if these ions, metallic ions, are simultaneously administered with tetracycline, then there will be formation of non-absorbable complex, and that will lead to inefficacy of tetracycline antibiotics because they are not absorbed. So tetracyclines can be given both orally and parenterally, and however there is irregular and incomplete absorption if taken by oral route, except minocycline and doxycycline. They are completely absorbed when taken orally. And then when there is formation of complex, they calcium chelates. These calcium chelates can get deposited in growing bones and teeth. So in children, the calcium complexes, the non-absolute complex with calcium, the chelates can get deposited in the growing bones and teeth of children in the form of tetracycline or calcium orthophosphate. So the complex is your tetracycline calcium orthophosphate. So that gets deposited. Then it can cross the placenta and can be teratogenic. So if it is taken between 6 to 14 weeks of gestation period, then it will cross the placenta and inhibit the growth or inhibit the organogenesis in the fetus. And it can be excreted via many routes. It can be excreted through bile, it can be excreted through glomerular filtration, it can be excreted through breast milk, it can be excreted through fecal matter, also through GIT, and mostly doxycycline is excreted in this route. Since it forms the complexes with these metallic ions, so tetracycline should be contraindicated with antacids, milk, iron preparations. So this is because of this drug interaction, the non-absorbable complex, they are contraindicated. So tetracycline should not be used along with milk. Now we'll discuss this side effects. So because of deposition of tetracycline calcium orthophosphate in the growing bones and teeth, there will be yellow coloration of teeth, dental hypoplasia. The color of tetracycline powder is yellow color, so yellow coloration of teeth will be there. Dental hypoplasia will be there. No growth or decreased growth will be there. Then bone deformities will be there. Then tetracycline, since it is a broad spectrum antibiotic, it can eradicate the useful bacteria in the GIT. The bacterial flora will be destroyed, which will lead to diarrhea. Then it can produce phototoxicity, and mostly demiclocycline. Demiclocycline produces phototoxicity. Then there can be dose related dizziness due to vestibular disturbances, and mostly this is shown by the minocycline. Minocycline shows dizziness, and as we discussed, this is teratogenic, so this should be contraindicated in pregnant women, and since it is excreted in breast milk, it should be contraindicated in nursing mothers or lactating mothers. Then it should also be contraindicated in children because it gets deposited in teeth and growing bones. So this is all about tetracycline antibiotics. Thank you.